Hello, I'm Dr. Phillip Mackinder. Welcome to Central Florida Eye Specialists and Laser Center. Presumably, you have recently experienced either flashes of light or a phenomenon commonly referred to as floaters. These symptoms can be quite alarming and cause concern. Flashes or floaters are a common reason for patients to request an eye exam. For us to fully evaluate your symptoms, it is necessary for our team to dilate your eyes. Dilation typically takes at least 45 minutes to an hour once the eye drops are placed in your eyes. The dilation usually lasts between 4 and 8 hours. While your eyes are dilating, I'd like to take a few moments to educate you about flashes and floaters. The good news is that the majority of the time, flashes and floaters are a self-limited, benign phenomenon that causes no harm. However, infrequently, these symptoms can be an early warning sign for a tear or detachment of your retina. During this visit, you'll receive a thorough examination of your retina to ensure there are no abnormalities. The back of your eye is filled with a clear, jelly-like substance known as vitreous. The vitreous is intimately adhered to your retina. Most people, at some point in life, will experience a posterior vitreous detachment. This is commonly abbreviated as PVD. This is when the vitreous jelly separates away from the retina. Most commonly, PVDs occur due to the aging process. However, events such as trauma and surgery can also cause a PVD to form. When the vitreous separates from the retina, it causes small areas of condensation. When light enters your eye, these areas of condensation cast shadows on your retina, and you will perceive them as floaters. Patients often describe their floaters as various shapes, such as a C or a circle, or a swarm of gnats or a spider web. Others describe them as a large cloud that moves with movement of your eye. Floaters themselves are harmless, however they can be quite annoying and bothersome. Floaters typically do not go away. The good news is that they do become less noticeable as time goes on. Over the next weeks to months, gravity tends to pull the floaters down to the bottom of your eye. In addition, your brain learns to ignore them with the passage of time. The majority of patients adapt to their floaters with time and learn to ignore them. However, most people still notice their floaters in certain lighting conditions. Flashes of light often occur simultaneously with floaters. Flashes of light are slightly more worrisome than floaters. Flashes of light are a result of traction on the retina. As the vitreous jelly separates from the retina, some areas of vitreous may remain adhered to the retina. If the vitreous does not release from the retina, traction results. The retina is nerve tissue that is a light receptor. If the retina is stimulated by the vitreous traction, it results in visual flashing lights. Many patients notice the flashing lights with sudden eye movements, such as looking to the far right or left. Most of the time, the areas of adherent vitreous eventually separate away from the retina and the flashing lights subside. Occasionally, the vitreous remains attached to the retina. As the vitreous contracts and separates, the traction pulls a tear in the retina. This tear can then allow fluid to accumulate under the retina and result in a retinal detachment. A simple tear in the retina can typically be repaired in the office using a laser, an injection, or a freezing technique if the tear is caught early enough. If the retina tear progresses to a retinal detachment, then surgery must be performed as rapidly as possible. Most retinal detachments can be corrected if caught in time. If your exam today reveals a PVD but no tears in your retina, we will likely recommend we re-examine your eyes in 2 to 3 weeks, as a PVD can take several weeks to complete. Typically, if your exam is normal in 2 to 3 weeks, your risk of retinal tear or detachment begins to diminish. If you have risk factors for retinal detachments, I may recommend more frequent evaluations. Risk factors include high myopia or nearsightedness, a prior history of retinal detachment, or presence of weak spots in your retina. However, if you experience the following at any time in the future, it's imperative that you call us and arrange to be examined within a few days. First, onset of significant new floaters. Second, worsening of flashing lights, that is to say they increase in frequency, duration, or intensity. Or thirdly, a dark spot or shade comes across your vision, like a shadow or a curtain. Again, any of these symptoms warrant a dilated exam of your retina within a few days. It's important to remember that not all symptoms of flashing lights are caused by a PVD. Other conditions, such as migraines, can also be to blame. We will evaluate you for these other potential causes during your consultation. I hope this information has helped you to understand the symptoms you are experiencing. We'll be happy to discuss this further with you and answer any questions you may have. Thank you for choosing us at Central Florida Eye Specialists and Laser Center as your eye care providers.